Welcome to this edition of Clinical Clips, an accredited continuing education activity. This brief expert video will spotlight the daily hot topics from the conference.
Hi, everybody. Paul Sachs here, and I'm Clinical Director of the Division of Infectious Diseases at Brigham and Women's Hospital and also Professor of Medicine at Harvard Medical School. And welcome to this, our final clinical clip from the 2024 AIDS Conference in Munich, Germany. I'm going to start us off with three interesting studies of HIV complications. And the first of them is clearly the most important, and it is a much anticipated study called Paso Doble. That was an investigator-initiated study out of Spain that is an open-label trial comparing people who are suppressed on ART and then randomizing them to switch to dolutegravir-lamivudine or to switch to bictegravir-FTC-TAF. They could be on any suppressive regimen at the start, but not dolutegravir or bictegravir. And in addition, because it's dolutegravir-lamivudine, they couldn't have chronic hepatitis B. And the study was done in Spain at 30 different sites, and it enrolled, about 500 participants. So it's a good-sized study, and it was powered on two endpoints: one, the virologic endpoint, and two, on weight. So the virologic endpoint turns out to be very much similar to what we saw in the Tango and the Salsa trials, meaning in this population without any history of resistance and no prior exposure to bictegravir or dolutegravir, dolutegravir-lamivudine was non-inferior to bictegravir-FTC-TAF, and there was no emergent resistance. And most of us would have expected this result. What was more surprising was that actually the switch led to more weight gain in the people switching to bictegravir-FTC-TAF than in dolutegravir-lamivudine. As you might recall from the Tango and the Salsa trials, there was an implication, at least, that dolutegravir-lamivudine would have very similar weight effects as bictegravir-FTC-TAF or TAF-FTC-dolutegravir. And it turns out that, in fact, there was nearly 1 kilogram more weight gain at week 48 than on the bictegravir-FTC-TAF than on the dolutegravir-lamivudine arm. So one observation was that people who were stopping TDF as their baseline nucleosides appeared to gain more weight on the bictegravir-FTC-TAF than people who stopped dolutegravir-lamivudine. And so this raises the question, is TAF actually driving weight gain? I have thought and have long thought with my colleague, Dr. Laura Waters, who's not been shy about this, that the best thing to do would be to do an intensification study. If you take people who are on stable dolutegravir-lamivudine and then add TAF and see whether they have any change in weight. You could even do a blinded study, but let's see if such a study goes forward. The second study I'm going to cite is actually a more exploratory study, and it was on a side effect of integrase inhibitors that's rare, but something that we all of clinicians see, and that's sleep disturbance. You might recall going back to the single trial comparing abacavir-FTC dolutegravir to TDF-FTC efavirenz, that one of the surprising results was there was actually more sleep disturbance in the dolutegravir arm, which was not what we expected, and it turns out that some of that might have been related to dolutegravir and some of that might have been related to abacavir, but we're not sure. So this is a small trial. They were only able to partially accrue it due to the COVID-19 pandemic. 19 patients were enrolled with dolutegravir-related sleep disturbance, at least insomnia on dolutegravir, randomized to continue the dolutegravir regimen or switch to bictegravir-FTC-TAF. And after 120 days, what they measured were patient-reported outcomes about sleep with standardized instruments, as well as something called a functional MRI. And what the results demonstrated was improvements in the patient-reported outcomes and also changes in the functional MRI that were associated with better sleep. They also measured inflammatory markers, but there was no difference. Again, this is an exploratory study, but since in clinical practice we sometimes do see insomnia on patients on ART, I thought it was interesting to highlight. One major limitation, aside from the size, is that it was open label. And of course, these sleep disturbances are very subjective. And the last complication study I'm going to mention is an old story, and that's the story of abacavir and cardiovascular risk. And you're probably thinking, why are you bringing this up again? Well, I think I'm bringing it up again because the study that was presented here was actually quite good. It was part of the Reprieve clinical trial, large clinical trial of people going on statins or no statins with low to moderate cardiovascular risk. And so this study was in some ways uniquely positioned to assess the association between ART and cardiovascular risk, because the MIs and the strokes and the other major cardiovascular events were independently adjudicated prospectively, making the endpoints really much more objective than they are in many of the observational studies done previously. So out of the nearly 8,000 participants in this study, 22% had a history of abacavir exposure, with 9 previous abacavir exposure and 13 with current abacavir exposure. And after doing the various associations and adjusting for baseline characteristics, they did conclude that abacavir was associated with a 50% higher risk of major cardiovascular events compared to no abacavir. They did not find any similar associations with tenofovir, protease inhibitors, or thymidine analogs. So it adds to the evidence. I mention this because there are still quite a lot of people out there on abacavir, lamivudine, dolutegravir, and that's a combination that arguably is no longer necessary now that we know that dolutegravir, lamivudine is so active. And now let me shift to talk about ART studies. And there were 3 ART studies I'd like to highlight. All of them are from low and middle income countries, but they do give us some lessons, I think, for practicing HIV medicine anywhere. The first is the final results of the DEFT study. DEFT study is a study of people with treatment failure on their first-line NNRTI plus dual NRTI regimens, a very common study design from resource-limited settings. And initially, it was comparing standard of care of darunavir plus nucleosides to dolutegravir plus darunavir. And in the course of the study, they realized that the TLD reference treatment of tenofovir, lamivudine, dolutegravir was becoming dominant based on the results of NAJA and other studies. And so they changed the design in the middle. But now they have this giant study, which actually has 3 arms for second-line therapy. And fascinating results at week 96 is that all the results really virologically favor the dolutegravir arm. So it's better than the historic standard of care, second-line therapy of boosted PIs. And it's reassuring because this is certainly where the field has moved globally. So there was more weight gain, not surprisingly, in the integrase inhibitor arms, but it wasn't sufficient to cause discontinuations. In a similar vein, that we had the updates from the VISEND study, VISEND, and this was conducted in Zambia. And the VISEND study was over 1,000 participants and divided into 2 groups. One group with virologic suppression, defined here as viral load less than 1,000. The other group, viral load greater than 1,000. And the viral load less than 1,000 group switched to TLD, and everything was maintained. There's pretty standard results now at this point. We're used to that. The study also included some people who went on TAF, lamivudine, dolutegravir, rather than TDF. So that's of interest. But Arm B is perhaps of more interest because Arm B included people with viral loads greater than 1,000. And this was a group heavily enriched with not just virologic failure, but extensive NRTI resistance. The investigator presented data that said 92% of the people in this arm had some evidence of nucleoside resistance, 64% with tenofovir resistance. So that's a very high number. And they were then randomized to either zidovudine, lamivudine plus boosted PI, or TLD, or the TAF version of TLD. And again, we see superiority of the dolutegravir strategy in this study, despite the fact that there was such severe resistance at baseline. Not only that, out at 144 weeks, they have not yet detected dolutegravir resistance. So unlike the Nadia trial, where they did have some patients whose adherence was poor and they ultimately rebounded with dolutegravir resistance, that was not seen in VISEND. In the last study, and full disclosure, I presented this study, but I presented on behalf of investigators, co-investigators who are in Haiti. And it's a study looking at people who are stably suppressed on their second-line boosted PI regimen. We know that these individuals in Haiti have a high likelihood of nucleoside resistance. And the intervention that was tested was bictegravir FTC TAF, which has not really been studied in this context before, and yet is commonly used in the United States for this purpose. And it was a 300-person study with a non-inferiority design. Stay on your boosted PI plus nucleosides or switch to bictegravir FTC TAF. The study was conducted during a time of both the COVID-19 pandemic as well as tremendous civic unrest in Haiti. and yet we were able to get to week 48. And, I'm saying this on behalf of Dr. Samuel Pierre, the lead investigator, and Dr. Serena Koenig, the senior investigator. There was only one virologic failure in the bictegravir arm and 6 in the boosted PI arms. And we do not have resistance data yet, but the results are certainly demonstrate that switching to bictegravir FTC-TAF is non-inferior to continuing a boosted PI, even in people who likely have extensive nucleoside resistance. We do have proviral DNA resistance testing in this study pending. So that brings us to the end of the last day of the 2024 AIDS meeting. I want to thank you for joining us for these clinical clips. Please refer to the landing page for slides and claiming your continuing education credit, as well as viewing the previous day's clips. Thank you so much for joining us.
We hope you found this activity useful and educational. To receive continuing education credit and to download your printable certificate, please return to the activity webpage and click on the Claim Credit button associated with today's clinical clip.